Today, we have the privilege of catching up with Dr. Nell, DAOM, licensed acupuncturist. She will be teaching a very interesting specialty classes at the 2023 Fsoma Acupuncture and Asian Medicine Conference, Sunday, August 27 at 1 p.m. The class is called Bridging a Critical Gap in the Standard of Care Post-Surgical Acupuncture. Hi, Dr. Nell. Thank you for talking with us today.
Hi, thanks for having me here. I'm so excited about the conference.
Excellent. So can you tell us what inspired you and led you to create this class?
Yeah, post-surgical acupuncture is how I built my practice. It's what I studied in my doctorate and did my research on. And I've really seen tremendous results for patients. You have patients who get a surgical procedure, and then they're pretty much told, take this pain medication and come back at this amount of time, and then you're going to start physical therapy. But we could be starting acupuncture right away. And anytime I talk about this and how I've integrated it into my practice and networked with surgeons, people want to know more. They want to understand these techniques. And so I wanted to make sure that I could bring it to this orthopedic conference.
That's wonderful. Make me want to take this class now. So what so what is the clinical application of the class that you will be teaching at the Fsoma conference?
Really how to integrate acupuncture as a modality. So, what's safe, what's not particularly safe, what is the pushback you might get from other medical providers, what are people generally on board with, how soon can we start acupuncture after surgery, what are the types of things that we're looking for, how you can actually set this up clinically in your practice so that it makes sense when you're starting to see a patient, before their surgery, after, talking about frequency, different needling techniques, as well as additional modalities that we can incorporate, like e-stim, for example.
That's absolutely makes sense. Yep. So so if I'm thinking to take this class, so what are the benefits for taking your class?
You're going to walk away with a better understanding of utilizing acupuncture for post-surgical care. So sometimes that can feel really intimidating. We don't know, how local we can go, what additional modalities we can incorporate into treatment, how we're phrasing this to other healthcare providers, and really explaining that value proposition and how acupuncture works and why it's so critical that we're able to start that process right away and address things like anesthesia toxicity, wound healing, decreasing infection, helping with scar tissue, overall just pain and inflammation, and just expediting the recovery process. So you really feel confident coming out of this class.
This is definitely a class that you need to attend. I definitely want to do this. But moving to the next question, can you share us with your professional history?
Yeah. So I did my master's and doctorate at Emperor's College. I actually started on the East Coast at Tri-State and transferred after my first year. And while I was doing my DAOM, I ran the teaching clinic at Emperor's. So I gained a lot of back office experience, as well as the clinical expertise through doing the master's and the doctorate, and grew my private practice in Beverly Hills, California. Also done consulting in the herbal industry mostly, with a few different companies, and now I'm growing consulting into different businesses. I am currently the director of development for the American Acupuncture Council, which is the oldest and largest provider of malpractice insurance for acupuncturists. And so that's thankfully allowed me a lot of improved access to advocacy work and moving the profession forward. And I currently also serve on the board of directors for the American Society of Acupuncturists as the vice chair of public policy. So did a few different things in the profession, but I absolutely love this medicine.
Wow, that's definitely a list. so is this going to be a technique class, or this is just a theory class?
It's more going to be theory, safety, and some techniques in there. More, we're not going to be doing a lot of hands-on work or anything like that, but you're going to learn specific protocols that you could use, different modalities, really what's safe and what's not. I'm guiding this based on the most common questions I get and the biggest needs that practitioners have to feel really confident when they're approaching other doctors to work with their post-surgical patients. So definitely a high value class.
That's excellent. So the last question can be like, could you describe a case where you had the best success using the topic that you're going to be talking about at the 2023 Fsoma conference?
Yeah, I've done a lot of work on orthopedic post-surgical patients. So some of my best successes have come from acute injury, but also from things like joint replacements. So I personally love working with knee replacement patients because a lot of times these patients are older. Sometimes they have difficulty healing, they have underlying deficiencies. And so it's really fascinating to see, based on someone's initial patterns, how that influences their recovery. And so you see dramatic results, particularly with joint replacements, because really you have this area of opportunity to just enhance their recovery. One of my favorite knee replacement patients was a 75-year-old man. And within 12 treatments, just over the course of 6 weeks, he was running on the beach and was so happy. And his surgeon was thrilled as well. And those are the kind of success stories that we want in our practice. And then we also want to be able to share that with other patients so that they're excited and motivated, and educate other providers so that they're excited to refer their patients to us for this type of care.
That's excellent. That's very inspiring story. So, so we come to the end of the interview. So I encourage all prospective students and practitioners to grab this opportunity to learn from Dr. Nell. Thank you, Dr. Nell, for sharing your valuable time and knowledge with us today. So
thank you.
Yeah, so as a reminder, Dr. Nell will be teaching Bridging a Critical Gap in the Standard of Care Post-Surgical Acupuncture. This is going to be live class in Fort Lauderdale Beach during Fsoma Acupuncture and Asian Medicine Conference. That's going to be on Sunday, August 27 at 1:30 p.m. This is going to be CEU for General for 3 credits. So thank you, Dr. Nell, and for everybody else, we shall see you there. Thank you.
Thank you.